Welcome to this module on poisonous snake bites in India. As healthcare providers, we all must have good knowledge about the prevalent poisonous snakes in and around us. We begin by acknowledging that there are 4 important poisonous snakes in India called the Big Four. In the coming slides, we will know more about these Big Four. They belong to 2 different families, Viperidae and Elapidae, but they have many differences. These differences help us identify them. It is extremely important to be able to identify the snake, and we'll be teaching you how. We need to look at the shape of their head, the pupils, scales, and fangs. So these 4 features will tell us about the family they belong to. For example, Viperidae have vertically elliptical pupils, triangular head that is very distinct from its neck, long and backward folded fangs, and keeled scales resembling the bark of a pine tree. Elapidae are exactly opposite in having rounded pupils, round head that is not distinct from its neck, small and fixed fangs, and smooth scales. In addition, there are some characteristic features that help us in further identifying the snake within the families. For example, cobra can be identified by the hood it forms. Vipers can be identified by a pit in front of their eyes, that is an infrared sensing organ. Kraits can be identified by their alternating light and dark bands. And saw-scaled vipers have sawtooth shaped scales on their back. By remembering the features specific to the families and then characteristics of each snake, it becomes very easy to identify the snake. Viperidae and Elapidae also differ in the type of envenomation they cause. Viper bite is painful and causes local swelling, bleeding, bleb formation, and even necrosis, whereas the krait bite is painless in contrast. Vipers remain active throughout the year and bite mostly during evenings and night time, whereas kraits bite only in the months of June to September when the fields are flooded with rainwater, and they bite the people who sleep on the floor. The painless bite of krait is often unnoticed, and the patients are found paralyzed in the morning and sometimes dead. Vipers lead to hemotoxic manifestations, which are bleeding from any site, renal toxicity leading to decreased urine output and cola-colored urine. Cobra also causes neuroparalysis, but in comparison to krait, cobra bite is painful and also causes local swelling and bleb formation. Local poisoning must be distinguished from the swelling that is produced by the tight tourniquet that people apply after the snake bite. Viper bites lead to hemotoxicity and are difficult to identify in first few hours. An early test is 20-minute whole blood clotting time. 2 milliliters of blood is drawn into a glass serum tube and kept undisturbed in an upright position for 20 minutes when the tube is inverted to check if the blood has clotted or not. The patient with an unclotted blood after 20 minutes is having a hemotoxic poisoning and will require anti-snake venom as early as possible. So, in this module, we have studied the Big Four, their characteristic identification features, the type of envenomations they cause. We hope you enjoyed the video. To know more about the snakes, do read the articles in the links provided in the resources section. In the next module, we'll cover the first aid and treatment of poisonous snake bites.